Hello, my name is Samantha OIds Frey, and I'm the CEO of the Illinois Association of Medicaid Health Plans. And today you're joining us on our Executive Corner while we talk about care coordination. In the month of May, we're doing a series on care coordination with our podcast, Sam Says, and we wanted to dive a little bit deeper into care coordination, what it is and what it means, and why it's important to the Medicaid program. So what is care coordination? First and foremost, care coordination is on a continuum. We have simple things like texting a member, making sure that they remember to get their COVID vaccine, their flu shot, or maybe just their general well visit checkup. But then we go much further where we're helping members get housing, getting to appointments, finding specialists, moving people out of hospitals into new homes that support their healthcare needs. So really, it's everything in between. Calls for reminders for appointments, organizing transportation to and from doctor's visits, ensuring that they're getting their pharmaceuticals in a timely fashion and in a way that's convenient for them. So it's really everything in between. And I like to think of care coordination as holding the hand of our Medicaid members as they travel the complex healthcare system that exists today. And that's why it's important. Healthcare, as we all know, is incredibly complex. And when you layer on social determinants of health or severe mental illness or substance use disorder, it becomes even more complicated. And this is difficult to navigate in the best of circumstances, but even more difficult in the middle of a pandemic. And so it's the role of our care coordinators to take the complex system and break it down step by step and empower the Medicaid member to navigate that healthcare system in a way that works for them. What are their priorities? What does this mean for them, for interacting with their family, for supporting their community, for getting the life that they want? It's our role as care coordinators and as health plans to help them make those goals a reality. And oftentimes when we think of care coordination, we think of the whole person. What are their collective goals that they want to achieve over the next few months or over the next year? And while there are clinical components to that, and those clinical components are critical, it's not only clinical. We also want to address the social determinants of health. We want to address what an individual may want, maybe reconnecting with their family, finding stable housing, losing 5 or 10 pounds and gaining some self-esteem. Whatever that is, we want to make sure that we're empowering that member to reach those goals. And so why does it matter? It matters because engaging and empowering a member in their healthcare journey helps them buy into it. They're going to care more about their healthcare. We're going to see improved outcomes. We're going to see increased adherence to medications, going to healthcare visits, going to that doctor's office, maintaining those visits, improving outcomes, decreased hospitalization, and overall an improved well-being. And so that's why care coordination matters. It doesn't happen in a fee-for-service system. It really can only happen with Medicaid managed care organizations and health plans holding the hand of those Medicaid members. And that is why we're focusing on these efforts throughout the month of May and how they can impact individuals, whether it be in small ways, reminding them of healthcare appointments or vaccinations that are needed, or in really large, significant ways in ensuring that members have housing, healthy food to eat, and the medications that they need. And so with that, we thank you for joining us today. If you're more interested in care coordination, please listen to our podcast series on care coordination on Sam Says this month, and like and follow us on social media, Facebook, LinkedIn, and Twitter. And also feel free to check out our website, imhip.net. Thank you.